Today, we're breaking down one of the biggest topics in pediatric primary care right now, the 2026 federal immunization schedule changes. If you've been seeing headlines about the vaccine schedule shrinking and you're feeling confused, well, you're not alone. Your patients' families are confused, you're confused, I'm confused, we're all confused. So let's get you up to speed on exactly what changed, what it means for your clinical practice, and what you should know for your family nurse practitioner board exams. Here's the big picture. As of January of 2026, the federal childhood immunization schedule went through major revisions. The number of diseases targeted by the routine vaccine dropped from 17 to 11. And the number of routine vaccines went from 13 down to 7. Before you panic, and before your patients panic, here's the key thing to understand. These vaccines didn't just disappear. 6 vaccines were moved from routine for all children to something called shared clinical decision making. The 6 vaccines are rotavirus, COVID-19, influenza, Hep A, Hep B, and meningococcal. So what does shared clinical decision making actually mean? It means that these vaccines are no longer automatically recommended for every child. Instead, you, the provider, have a conversation with the family to determine if the vaccine is appropriate based on individual risk factors, exposure history, and family preferences. Think of it as a personalized vaccine recommendation rather than one size fits all. For example, if you have an infant whose older sibling just started daycare, that rotavirus vaccine may be strongly indicated. Or if you have let's say a college kid, a 17-year-old, then the meningococcal vaccine is still very much on the table. Now, let's talk about what's still routinely recommended for all children. You've got the DTaP, the HIV, the polio, MMR, varicella, pneumococcal, and the HPV. But here's the catch on the HPV. The dosing changed. It went from 2 or 3 doses down to a single dose. And this is important because insurers are now only required to cover a single dose. If families want the additional doses, they may be paying out of pocket, and we're talking over $300 per dose. Here's some good news to share with worried families. Most insurers are still expected to cover vaccines under the shared clinical decision making at no cost. The Affordable Care Act requirements haven't changed, and many insurers have pledged to continue covering all previously recommended vaccines through the end of 2026. The main exception is those additional HPV doses that we recently discussed. Here's where it gets a little complicated. Not all states are following the federal changes. As of early 2026, 24 states no longer use the U.S. Department of Health and Human Services or the CDC as their primary source of vaccine recommendations. Many states, especially those with different political leadership, continue to follow the CDC or the American Academy of Pediatric guidelines that still broadly recommend vaccines like the flu and the hepatitis shots for all children. Your takeaway here is always check your state's specific requirements. School entry requirements and state recommendations may differ significantly from federal guidelines. Let's talk about what this means for your day-to-day practice. First, documentation hasn't changed. You're still going to document every vaccine that it's given, including the shared clinical decision vaccines, in the patient's records and the immunization registries. Second, patient education is crucial. Families are confused. Your job is to explain that all vaccines are still available. They're still covered in most cases, and they can still be recommended based on individual needs. Frame that shared clinical decision making is a personalized care, not as the government saying vaccines are unnecessary. Third, know your risk factors. When should you still recommend those shared clinical decision making vaccines? Think daycare exposure for the rotavirus, chronic conditions for the flu shot, travel history for Hep A, and college or military, dorms for meningococcal. Will this be updated on board exams anytime soon? Probably not. But you should still make sure that you study all the vaccine schedules, including the ones that fall under the shared clinical decision making. So to recap, know which vaccines move to the shared clinical decision making: rotavirus, COVID-19, flu, Hep A, Hep B, and meningococcal. Understand that shared clinical decision making doesn't mean unavailable. It means individualized recommendation. Know the risk factors that would prompt you to recommend each state clinical decision making vaccine. And remember that the HPV dosing changed to a single dose, with insurance implications for additional doses. All right, that's your crash course on the 2026 immunization schedule changes. This is definitely a topic that could show up on your day-to-day practice, so be ready to discuss this with your patients and their families. If you want more details on any of this, I've got a full blog post with practice questions linked in the description below. Don't forget to hit subscribe if you haven't already, and I'll see you on the next video.